Welcome back for your third and hopefully final lecture of Chapter 1. So this lecture is going to focus on the language of anatomy and physiology. We're going to talk about different body regions. We're going to talk about why it's important to understand and learn these terms. We're going to finish up this section with how we can view different body regions using different medical procedures like x-rays or CT scans or MRIs. So the first thing I always like to go over is why is it important to understand the language? So when people take my class, they always say, there's so much memorization, I have to memorize everything. And you know what? You are correct. You do. You have to memorize a lot. Everybody who takes anatomy and physiology has to memorize a lot. So you're not unique. I'm not a unique instructor in that I make my students memorize. All instructors make their students memorize in anatomy and physiology. You have to learn the terminology of this class. And there's a reason for that. If you have a scar on your wrist and you're trying, or a wound on your wrist is actually a large structure, and if you're trying to describe where the scar is, well, he has a scar on his wrist, that doesn't tell me a lot of anything, because here you have a scar on your wrist, but here is a scar on the wrist, and which one is the scar that we're talking about? Well, it would depend on really how you describe it. So this scar is on the anterior aspect of the wrist, and it is this scar, this scar, I guess is the better term, is on the posterior aspect of the wrist. This is on the lateral side. This one is close to the intermediate region of the wrist. Do you see that? Whereas this one is way closer to that thumb. That would be like way over here on this hand, right? So you have to learn the language so that you can describe it a lot easier. I always, I get told by a lot of students, and this happens all the time, they don't think that my class is necessary or that learning these terms is really necessary. But I would argue that you wouldn't want to take a vehicle to a mechanic that didn't know what a hubcap was. Would you want to take your child to a doctor that didn't know what the anterior aspect of the carpal region was? Probably not, because it's the same thing. I mean, it's not the same as a hubcap, but the idea is the same. Makes sense? So there's a lot of terms, and here those terms are kind of blurred on this PowerPoint, but in the actual lecture you can see all the terms really nice and easy. You have the frontal region, the cranial region, you have the buccal region, nasal region, cervical region. I'm not going to go over all of these terms. You do have to memorize all of these terms. And there are two types of terms. So like it says plantus or plantar. I don't care which one you use. I tend to use the ER-AR terms more, or AL. Those are the ones that I tend to use. But you can use either one. I don't care. You'll get the points for either type, okay? You do have to know all of these terms. There's a lot more terms than just this. You also have to know the directional terms. I will go over directional terms because directional terms tend to be the harder things to learn. So memorizing terminology of the body is not so hard, but memorizing terminology of directions can be confusing. And so the first thing I always like to point out is our bodies anytime you're looking at a person, you always want to assume they are in what we call anatomically correct positioning. So this figure right here is an anatomically correct position. Her head and eyes are facing forward. Her arms are anterior. Her palms are anterior. Her legs are anterior. She's not slouching. She's not bending her knees. This is anatomic position. Your patients will not stand like this. You have to assume this position for your patients when you're trying to determine directionally where something is. So the anterior aspect is the front of the body, also known as ventral. Posterior aspect is the back of the body, also known as the dorsal side. Superior is towards the head of the body. Inferior is towards the tail. You can also use, I tend to use superior and inferior versus cranial and caudal. I just like those terms better. Medial is towards the midline of the body. Lateral is towards the sides of the body or away from the midline of the body. Now this is where it gets confusing. Proximal and distal. Proximal and distal are only used when you're dealing with the arms and legs, your appendages. And I always tell students to remember, appendage has P's and D's. A proximal and distal has P's and D's. So when you're trying to determine if you're dealing with proximal or distal, think, are you dealing with the appendages or not? If you're not dealing with appendages, then you're probably using superior, inferior. But if you are using appendages or dealing with appendages, then you want to use proximal and distal. Proximal means closer to the point of attachment to the body. Distal means farther away from the point of attachment to the body. So your elbow is proximal, your hand. Your hand is distal, your fingers. I'm sorry, your hand is distal, your wrist. That's what I meant to say. Your fingers are distal, your hands. Does that make sense? You can do it with the legs as well. The patellar region is proximal, the tarsal region. The femoral region is proximal, the patellar region. The crural region is distal, the patellar region. There are 3 very commonly used planes. So a plane or a section of the body is used to dissect organs or used in the medical field during operations, or when you're sewing up a wound, you might have to use one of these planes to fix the damage or something. The 3 most commonly used planes in medical imaging, in surgical procedures, you're going to have a sagittal section, a coronal section, and a transverse section. The sagittal section is what cuts the body into right and left halves. So this plane right here that I'm kind of moving my pointer along, that's that sagittal plane. And it has one eye on one side and the other eye is on the other side of that plane. The coronal section, right up here, cuts the body into anterior and posterior portions. So you can see here, with the coronal section, she would have half of her head, half of the brain, maybe the ears on the posterior aspect, and then the eyes and nose on the anterior aspect. Okay. Transverse plane cuts into a superior and inferior section. So superior is going to be above or closer to the head, inferior closer to the tail. And this is also known as a cross section. So a lot of our organs are made into cross sections, so you can look at them. So here's an example of how we will be using these planes or these sections. You will get to dissect a rat this semester, or you should be able to. I'm assuming I didn't have all my rats like ruined or something. You're going to do a sagittal section right along the anterior aspect or their ventral body cavity. And then you're going to have to do a transverse section cutting across to get to both of their arms, their upper arms. You're going to do another type of cut, which is not as common, but it's known as an oblique cut, to cut down so that you can then open up the entire body cavity and look at the different organs inside. So when we do open the body cavity, we'll get to see different regions. So we have this thoracic cavity up here. The thoracic cavity contains the lungs, or a region for the lungs, another region for the heart. The lungs have their own special membrane surrounding them called a pleural membrane. The heart has its own special membrane called the pericardial membrane. And then we have the abdominal pelvic cavity here, which includes both the abdominal and the pelvic cavities. So we can separate them, or we can call them the abdominal pelvic cavity together. And these have their own special serous membrane surrounding them, known as the peritoneum. Because this abdominal pelvic cavity is so large, we also separate it into 4 quadrants and 9 regions. The regions, I expect you to be able to tell me the quadrants and regions. I like the regions because they separate the abdominal pelvic cavity further to where you can pinpoint specific organs. So, and they're not hard. Really, you have a right and left organ, and then you have 3 middle organs. Okay, so like you have this right hypochondriac region and a left hypochondriac region. Right lumbar, left lumbar, right iliac, left iliac. And then down the middle, you have the epigastric and the hypogastric region. And then right in the very middle is that umbilical region. So here's an example of what I might ask. Patient John Doe was complaining of pain in his. So I might ask you to name this abdominal pelvic region. And I might ask you, which quadrant is it found in? So you should be able to answer both of these questions. I'm not going to tell you the answers. If you're unable to figure it out, you can definitely come talk to me. Or, you can always go back to this picture and figure out which region. And then I often like to ask, name an organ that might be causing the problem. So at this point, you need to know, you don't have to know every organ system and every organ perfectly, but you have to know some of those larger organs and what organ systems they belong to. So in this case, we're looking at this region, and you might want to say, okay, what's this organ right here? If you're not sure, you can look it up. So I'll just let you know that this organ here is the stomach. So that could be an answer. Next to the stomach, way over here, is the spleen. That could be another organ you might ask, you might put in. So I told you that the thoracic cavity had the heart and lungs, and that each of them had their own serous membrane. The serous membrane is composed of 2 layers, and it's kind of like a balloon. So the layers run with each other. So here's one layer, and then here's the other layer. The outer layer is known as the parietal membrane. The inner layer is known as the visceral membrane. I always remember PC for parietal cavity, and then VO for visceral and organ. Surrounding our heart, we have the pericardial membrane, composed of a visceral and a parietal layer. PC, parietal, would be out here. VO, visceral, would be inside. The function of serous membranes is to reduce friction as the organs move past each other. So these organs are constantly in motion, and there's a lot of stuff in our body. So we need to have protections around those organs so that they can slide past each other without damage. Here you can see the lungs. So the heart would be here, the lungs are right here. And this is your pleural membrane. The pleural membrane is consists of your parietal and visceral parietal and visceral pleura that allow the lungs to move without damage or friction. And then surrounding your abdominal pelvic organs, we have the peritoneal membrane. Some abdominal pelvic organs do not have a full peritoneal membrane surrounding them. Some are only partially covered, and so those are known as retroperitoneal organs. They have one layer of the peritoneum, but they don't have both. So in this case, you have that parietal layer, but there's no visceral layer surrounding you. But over here, then you have the visceral and parietal organs, or visceral and parietal layer surrounding you. Okay. The last thing we'll talk about then is medical imaging. Historically, it was really hard to determine what was going on inside the human body, and the reason for that is because we couldn't see inside the human body. So if someone had a swelling, if someone was complaining of pain, all you could do was either a surgery, which didn't often end well for the patient because they also historically didn't use the best aseptic technique. So they could have surgery and hope everything went well, or they could just, suck it up and, hope the damage, whatever was wrong, didn't have severe issues or didn't cause severe issues with the body. Today, though, we have a lot of mechanisms for identifying or imaging internal structures. One of the important and probably most popular mechanisms is called an X-ray. An X-ray is just a visualization using gamma radiation to see the hard structures of the body, so like bones right here. We now can use a special type of X-ray called a CT scan to make basically a transverse image of the body, of a specific region of the body, which can help us identify if there's something, growing or something wrong with a certain region of the body. We can use MRIs, which are even, they're really fancy. They allow us to see more soft tissue. We don't have to just look for the hard tissue. And it uses magnets to find these different structures in the body. So seriously high-leveled magnets that will allow you to look at different structures in the body. And probably the most or the least invasive is the ultrasound, which is used on specific regions of the body that are more likely to be sensitive. So the main thing that I think of with ultrasounds is pregnancy. But I'm going to show you this video of the CT scan and of the MRI machine.
The CAT scan is a medical procedure in which a specialized X-ray provides a cross-sectional image of the body. A patient lies inside a tunnel equipped with a scanner. The scanner consists of an X-ray emitter 180 degrees across from the receiver. The patient's bed slowly moves through the tunnel and stops. The scanner circles the patient, and X-rays are beamed and received at many points along the circumference of the tunnel. Each time the bed moves, the scanner circles again. A computer analyzes the information received by the X-rays and constructs an image of a slice of the body.
That would be a transverse section of the body, by the way. This video of the MRI shows how an MRI is used. It doesn't really give a lot of information about the actual function of the MRI. It's more a video to help you understand, like, so that you don't stress out if you're having an MRI, because MRIs can be very, very scary since you're being put into a tube. It feels kind of claustrophobic for some individuals. I watched the video, and I will let you know that I did not have the experience that lady had. I think this is a much nicer MRI machine, but maybe that's how the experiences are nowadays. So that'd be nice. I don't know. So here again, you have that X-ray showing the bones of the hand. And here you see a CT scan of the brain. This is an MRI machine that generates an image using a magnetic field for a high resolution. This is a PET scan. And PET scans can be used in to help you identify like blood flow regions or help you identify tumors in the body. And then this is an ultrasound, which is used typically when you need less invasive activities being done. And at this point, we are done with the chapter. So only 3 lectures, so not too bad, right? You should be able to go through and answer the questions to the interactive link that they have. There are some review questions. There's some critical thinking questions. I tend to use review questions, critical thinking questions. I may even use an interactive link question on my exam. I tell people this all the time, and I'm always amazed at how many people didn't even look at the questions. You want to make sure that you have the study guide for Chapter 1 filled out so that we can actually discuss the questions. So during our discussion portion of our class, we're going to be going over study guide questions. I expect that you're going to know or you're going to have listened to the chapter lectures, and you'll be able to just go right into the actual, questions that you're struggling with. Okay? So I will talk to you guys next time in class. Bye.